Hi, my name is Eric Smith. I'm a first-year dental student at the University of Connecticut School of Dental Medicine. Just a little bit about myself. I was born and raised in Ontario, Canada, near Niagara Falls. My father's a dentist and my mom's a pharmacist. I went to undergrad at the University of Toronto in Toronto, and I finished my degree in June of 2011 in biophysics and biochemistry. First and foremost, working with my hands really feels right. And especially the finer and more delicate the work, the more satisfaction I get from it. In my undergrad, I was fortunate. I chose to pursue research projects in the summers of my undergrad, and because I was a biophysics student for a while, I was working mainly in structural biology labs, protein crystallography, X-ray microscopy, that sort of thing. So a lot of that, because you're working only on the microscopic level, required working with manipulating small protein crystals underneath a microscope. You know, you're manipulating these crystals with a probe that is, 0.5 of a millimeter thick, and being careful not to fracture them as you flip them from one solution into the other. So I got frustrated with the research after a while, after not getting results, but I found that what I really gained satisfaction from was the fine, delicate work of my hands, and that, like I said, it felt right. So that was one of the primary prompts for me to look into pursuing a dental education. Additionally, I really love people, and dentistry is a real profession where people skills, excellent people skills, are required and will really enhance you as a professional. And further, I love to help people. So those are the main reasons. Also, my father's a dentist. He initially didn't want me to pursue dentistry. He wanted me to find my own route. So it was good because he sort of helped me to explore other fields, but I, on my own, found out that dentistry was right for me. I am interested in a career in academic dentistry, combining that with clinical, and I love benchside research, but a career in pure academia was not for me. I discovered that. I would like very much to teach after dental school, and I would like to combine that with a life of clinical practice and perhaps a research life. So there's dentistry, people don't realize, is a field that offers so much in terms of variety. People think that it's limited in terms of variety relative to the medical profession, and that is very short-sighted and not true, especially when you think of combining with aspects like academic dentistry, teaching, public relations. There's so much you can do with it. It's because of the people who inspired me to go into dentistry. So I worked for I worked in Dr. Christopher McCulloch's group at the University of Toronto. Dr. Chris McCulloch, if any dentists are watching this video, any dental professors are watching this video, have probably heard the name. He is very famous for excellent basic cell science research. He's also a practicing periodontist in a private practice. He's an incredible man, he's an incredible researcher, and he maintains both an active research life and an active private practice. And there's not many people who are able to balance the two, but those that do absolutely love it. And he was definitely one of my inspirations for pursuing a dental profession. When I saw through research in his lab the sort of things you can do in academic dentistry, combining all of my loves, clinical practice, teaching, and research, then I've just been inspired. I would really like to pursue that. First and foremost, I want to get a good practical clinical training, and then I'll pursue my other interests like research and teaching. Implants right now are is a very hot research field, and a lot of stuff surrounding that, especially So there's implants, but there's also periodontal disease has always been a very fascinating field of research, especially if you're into immunology and infectious disease. Some excellent work is being done at the University of Connecticut on this topic. In fact, a few breakthroughs have occurred just in the past year in it that are catching national attention. I'm very excited to be here for that reason. Especially the connection, what I want to see, what I would like to be a part of, the connection between oral infections, oral hygiene, and systemic health. Many studies have alluded to the connection between atherosclerosis and dental hygiene, but I think, and researchers now at the University of Connecticut are establishing a much more direct connection between the microflora that occupies our mouths and the mouths of sick patients, the lipids and peptides they produce, and how that affects cardiovascular health. Now that is an incredibly exciting interdisciplinary field of study to get involved into, and it's just now starting to take fruition. Having a father who's a general dentist was a great deal of help, an enormous help. Not only has he been through the application process, he's been, he's been through dental school. He's been a practicing general dentist for 34 years, and he was a very, not to brag, but he was a very prestigious in his class. I graduated from the University of Toronto in 1978. Out of a class of 130 students, only 5 graduated with honors, and 1 was my dad. And he graduated with honors because of his strong clinical, practical, his grades in his practical clinical courses, not because he was particularly smart with the didactic material. So he's an excellent hands-on, a real intellectual and an excellent hands-on guy. So he always emphasized to me that I should choose the dental school that gives you the best practical clinical training. And I chose UConn specifically because, well, first of all, the American schools, a lot of them, and many Canadian schools do as well, but especially a lot of the American schools are at the forefront of providing an excellent synthesis of strong clinical training, number one, good basic science background, and the schools are keeping up to date with the most recent dental methods, dental technologies, and I wanted to get a good education in that. And just exposure to the profession overall. And so that's really what I was looking for when I was applying to dental schools. And it's difficult when you go on I was initially doing the research on the dental schools, so you start by Googling it and going on their websites. But the websites don't tell you anything. They don't, because part of advertising is each school is trying to sell themselves. They will all say the same things. It's like they plagiarize each other and just change the mascot. It's pretty funny. But there really are good forums and good information out there on how to differentiate between a good dental school and a bad dental school. My recommendation for students who are applying is to come up with a list of criteria of what they value most in a school. And because you're going to be spending the next 4 years of your life there, also what kind of environment they want, what kind of educational environment, and then go on forums online, talk to students, graduates from each school. Just email the Dean of Admissions and ask, can you give me the email address of a few students who'd be willing to talk to me? Take the time, go there, go to the cities that they're in, spend a little time. I know this is a very time-consuming process, but it is the rest of your life. And you do have the time when you put that in that kind of context, and it's extremely important. There aren't too many decisions in your life, single decisions, that have such dramatic effects on shaping the rest of it. But choosing the right dental school is one of those decisions. So you want to make sure that you don't want to be kicking yourself because you had insufficient information to make the correct decision. Because in this day of age, that's an unacceptable excuse. and that should not be something you're telling yourself in the coming years. So getting back to my story specifically, I came up with a list of criteria. I came to UConn because it's the best, and probably among the top 3 dental schools in the United States, probably on the continent, in terms of integrating an excellent clinical program with basic sciences and research exposure. I love it here. I've really had a blast. It was quite an adjustment. It was, I mean, you have to think about it. You are going from a situation where you have 25 hours of class a week, even with labs, to a situation where you are there from 8 until 5 days a week. A lot of times I get to the dental school at 7, I leave at 9, because and after you're done class at 5, you have to go and do homework. So, but you do adjust. It was an adjustment, but you do adjust. To be honest, it took a few months to get into the swing of things, but then you start loving it. This first year has been an intellectual ecstasy. Just it's strong language, but I think that's the best way to put it. This has probably been academically, intellectually, or all around, I would say, probably the best year of my life. A lot of my friends took those prep courses. I just bought the books for the prep courses and I prepared by myself. I went on forums, got advice on what different sections were like, read a lot of textbooks, reviewed old class notes from my undergrad, which were quite good. Went through entire AP bio and chem books. Those were quite good. I think the day of, as with any standardized test, relax and enjoy yourself. And I actually did. You might think that is a little bit strange, but you're freaking out at the beginning. But after half an hour, it's a 5.5 hour test, you really do get in the swing of things and sort of realize that you're well prepared, and let's just see how well I do. And you know what? Worst comes to worst, you can always take it again. To those who are unsure of whether they want to pursue a career in dentistry or what career they want to pursue, I would say get out there into the workforce and start by talking to people, send emails, talk to people who do these jobs on a day-to-day basis. Start with that, and then ask if you can shadow. That's great. Or ask if you can assist. Get as much on-site exposure as you can, and not just resort to reading on the internet. Talk to students in this professional schools or whatever school you need to be that, to do that as your job. Talk to people in every step. The students, the recent graduates, the people who have been working at it for a while, people who have retired, see how the profession has changed over time, see what it entails. Think about what kind of lifestyle you would like to have and see if that matches. If you want to be a real family man, 6 kids, maybe choosing a profession where you're constantly on the road and traveling isn't as much for you. Whereas if you're more spontaneous, maybe you get the idea. Dentistry in particular is incredibly rewarding if you love working with your hands. I would say dentistry is for a very, very select few individuals. A lot of people will get very, very frustrated over the fact that the success or failure of a restoration is going to be the difference of 1/10 of a millimeter. People like me and my classmates, it sounds strange after making my last sentence say, we sort of get a rush from that, actually, and it really, it's very, very incredibly satisfying if you love working with your hands to be a dentist. And if you love people, and if you're good with people, I couldn't picture myself in any other profession, and I'm more and more sure of that every day. It sounds flowery, but again, I've thought about it a lot. I'm very excited to wake up every morning and come here. Very excited, especially on days where I get experience with with my patient here, because I know I've made the right choices.